Are you one of the millions of people around the world who are living with chronic fatigue, with chronic pain, with numbness, with tingling, with a list of symptoms that your doctors have not found the answers to help you feel better? If you're one of those millions of people, I think you'd like to watch this video. My name is Dr. Herman, and in just a few minutes, you're going to hear what this woman has to say and why she has such a big smile on her face, because the symptoms she suffered for 5 years are nearly completely gone. Almost all of them are completely gone. It's remarkable. So let's just take a moment and hear some tidbits of what she has to say about her improvement in her first month under my unique care, and then we'll be back to talk about what I found and how she's gained this incredible relief. So let's listen to her first for a few minutes, and then you'll hear me, and then you're going to see her whole testimonial, which is about 20 minutes in length. See you in a few minutes. On the phone, you're doing so remarkable already within the first month of your first protocol with me. That
Yes.
I just started. So how long had you dealt with these symptoms before you came to my clinic?
I've dealt with them for almost 5 years.
Were all of these symptoms constant, or did you have
Yes,
break? They were constant. Okay.
they were daily.
Your chronic fatigue on a scale of 0 to 10, if 10 is the worst fatigue, the worst exhaustion, could you describe what yours was like?
Mine was 10 and above. I mean, it's when I started having my stomach problems where I couldn't eat.
Hmm.
And I mean, I could not eat, I could not drink water. It was just daily where, I mean, I'm not a big person to begin with, and I was just losing weight. I mean, in a month, I lost around 20 pounds. It was a burning feeling. It just felt like my stomach was on fire. And it was like my stomach was bloated. Just I felt like it was swollen. And it was just painful. Now, since I started the protocol, I'm actually really good. I can eat, I can drink all the water I want. And I mean, I have the energy. So I'm doing really good. I'm so
Excellent.
grateful.
You also had muscle pain and joint pain. How's
Yes.
that now? How severe was it, and what is it like now?
Oh, it was horrible. I mean, I would walk and I'd be ouch, ouch, ouch. Now it's a lot less because the bottom of my feet hurt so bad that I know we've all been to a Costco or a Sam's, and when you walk in there, they have those little things on the entrance that are like little circles that you roll your cart through it and it goes tut, tut, tut.
Mhm.
And those little circles, I would step on them with my shoes and I couldn't stand it.
Mhm.
I would tell my husband, this hurts me so bad. Now it doesn't hurt. I
Awesome.
walk right through them like nothing.
Awesome. There's no other medications besides these remedies that you're taking from me.
Yeah,
Yeah, that's it.
that's all I'm taking.
And the heart racing feeling, the anxiety feeling, that's decreased.
It has. It
Yeah.
has
First, you're feeling
decreased. Yeah, I am feeling a lot better, and it's like I'm just I'm just doing really good. I'm so excited.
Yeah.
To Yosemite, and it was beautiful. And we took it was a 5 mile hike, and it was uphill. Let me tell you, that was steep. And I did amazing. I had no shortness of breath. I had no fatigue. I mean, it was really good. Everybody was telling me, slow down. I thought you were the sick one. They were huffing and puffing, and I'm just like, oh my God, I love this.
Excellent.
For me, what I want to tell people is I know that sometimes, we look at ourselves and we're not feeling good. We're literally at our end, and we think I can't do this because I can't afford it. I feel that you should look into whatever you can to make it to your clinic, because it'll be worth it. Every penny you spent, it will be worth it. I promise. I'm proof of it. Look at me. I'm smiling.
Yeah. They didn't get to see you when you were in pain. So, but yeah.
Oh,
Wow, isn't that just incredible? I mean, her stomach pain she suffered for 5 years is gone. The nausea is gone. The headaches are gone. The joint pains in the upper part of her body are gone. The muscle aches are gone. Her chronic fatigue is gone. She was able to go on a 5-mile hike with ease. She impressed her friends and her family, and it's quite remarkable. Once again, my name is Dr. Lonnie Herman. You can find more of the information, learn more about my work on my website. I'll put the website link down here at the bottom of the screen. It's my name, drlonnieherman.com. And I have merged many different types of methods together in many different sciences to help create this amazing package of a system that I work with in here, my process, my method of helping you heal from chronic ailments. I called it Rapid Health Recovery System. And the goal is to be able to get you better, of course, but the purpose is to find the causes that led to your disease, that led to your ailment, that led to your pain, your chronic illness. A lot of these causes, these hidden infections and chemicals, are not found in regular blood tests. They're not found in stool tests. They're not going to be found in hair analysis. They're not going to be found in urine analysis. There's just too many different types of infections and chemicals that can evade various methods of laboratory analysis and even image studies like MRIs and CAT scans and x-rays. There's just so much that we need there's so many different causes that we need to find and use different methods of finding where these different infections and chemicals are, and have a precise method of actually helping your body get rid of those chemicals from parts of your brain, from your thyroid gland, from your stomach, from your kidneys, from your ureters, from your bone marrow. It could be in your pancreas, in your liver. Infections and chemicals can exist anywhere in your brain and anywhere in your body. And that's what I do, is find these different infections and chemicals that have evaded regular medical tests, and even what's called functional medicine testing. I help people find them, and I help them get rid of it from their own bodies so they can recover like this woman has. So first thing I'd like to tell you is that she hired me to do all of the tests that I offer. I did a very thorough residence diagnostic test with her, which I found different infections. We're going to talk about that in just a moment. And different chemicals in her tissues. We'll talk about those in just a moment. I did a very thorough dental examination that I performed. And you go to my dental page. I'll put the link here on the screen and below this video. The dental exam is very thorough, and I'm able to find different infections and chemicals that are linked to different parts of the body's disease patterns that are going on. And she also did she hired me for a very thorough food analysis, and that's different than a regular food laboratory that you might have run for food sensitivities or so-called food allergies. So we did all these different tests and came up with an amazing plan for her, amazing protocol for her to start healing, and she's recovering at such an incredibly rapid pace, and you can too. Some people heal fast, some people it's going to take a little time, some may not have such a remarkable recovery in the first protocol, but with enough work, with enough time, and a short period of time, it's going to be a rapid health recovery for you too. So, and again, for the food examination and the food analysis that I do, I'll put the food page up here on this video, as well as below this video in the description. And you go there and learn. There's so much information that you're not given by your regular doctors, and we need to start to open our mind, open our heart, and understand that there are other methods out there that can help us recover our health. Because without your health, you really have nothing. And that's the reality. I found with Mrs. Mower, who came to my clinic from California. In South Florida is where my clinic is now. I found she had in her stomach that was causing her burning pain, terrible stomach pain. That was causing part of the nausea, causing part of her body pain. When your stomach is infected, I'll tell you something, your head can hurt from that, your body can hurt from a stomach infection. Well, I found with her that she had, I'm going to name a few here. She had Lyme infection in her stomach. She had the influenza virus infecting her stomach. And you do not have to have flu-like symptoms of cold, fever, chills, symptoms, or runny nose to have the influenza virus causing a problem in an organ. The influenza virus can exist in any part of your body. Just like, for example, the streptococcus infection. You can get a strep throat. You've heard of that term, strep throat. Well, that streptococcus bacteria doesn't have a GPS tracking system built into it that makes it just go for the tonsils or go for the throat or go for your gums. It can go to your brain. The streptococcus organism can flow through the bloodstream, just like if you were on a raft in a river or raft in a stream. The water is going to carry you wherever the water is going to carry you on your raft. These organisms get in the bloodstream and they can migrate through the blood, flow through the bloodstream to go anywhere, to your lymphatic system, to your organs, to your brain, to your ear, to anywhere. So I found with her, again, we'll start over. I found the Lyme in the stomach, influenza in the stomach. I found the human papillomavirus affecting her stomach. I found multiple parasitic organisms affecting her stomach. And let me just go back. Yes, the HPV, the human papillomavirus, can go anywhere in the body as well. It doesn't only go to the cervix in a woman. I have another patient who comes to me with a problem for the Gardasil injection that we're working against that caused bone failure in this young man, 22-year-old. The reason why he had the Gardasil is because his father had throat cancer, and the doctors, when they took a biopsy of the throat tissues where the cancer was, they said it was caused by human papillomavirus in his throat, this man. Okay? So human papillomavirus was in her stomach. Parasitic infections in her stomach. Epstein-Barr virus in her stomach. A group B streptococcus bacteria in her stomach, H. pylori bacteria affecting her stomach, Coxsackie virus affecting her stomach, parvovirus affecting her stomach, causing her stomach pain. I also found inside the stomach lining, which is in the stomach, called the stomach mucosa, which is the inner surface of the stomach, where we have stomach mucus layer to protect ourselves against the stomach acid. She also had Lyme infection in that tissue as well. I also found that in the sphenoid sinus, I'll try to put a picture up here to show you where that is. It's right behind the eyes, deep in the skull. The sphenoid sinus had the group B streptococcus bacteria also. She had a streptococcus pneumonia bacteria affecting the arteries, called the carotid arteries, that bring blood into the brain. When those arteries are infected, number one, you'll have inflammation in those arteries. Number two, you can have pain in the neck because those arteries are connected to, it's all right in the neck muscle, cervical spine area, as well as those arteries bring blood up into the brain. So there's inflammation wherever those arteries are carrying blood. So the streptococcus pneumonia affecting her carotid arteries. I found in her liver, where she had liver pain as well, I found residues of an antibiotic called tobramycin. I found lidocaine, the dental anesthetic chemical. When you get dental work, they inject that numbing agent in your mouth. After about 4 hours, 5 hours, when the numbness of the mouth disappears and you have normal sensation come back, where did that numbness agent go? Do you think it just disappeared? It went into the air? Well, it can travel to any organ and part of your brain, even to your thyroid, to your liver, to your kidney. I found this in the cortex, the outer part of the brain. The cortex has motor control and sensory control to the whole entire body. You have upper motor neurons that help to regulate motor control to your hands, to your legs, to your feet, to your shoulders, to your spines, to the muscles, to the organs, to the heart. As well as all the sensations are, let's say, perceived in that part of the brain called the cerebral cortex. Well, what these scientists have been able to do is cut off the skull cap and expose the cortex and stick a needle into the cortex, put a pin in there. Nobody feels the pain up here. They don't feel a piercing into the cortex, but they feel it where the body part is represented in that part of the brain. So for example, let's say they put it here in the cortex and somebody would feel it in their hand. They put it here and they could feel it in their tongue. Just for example there, yes. So when the numbness agent, the lidocaine from the dental work, absorbed into the cortex of her brain, it changed the way the body was able to feel. Her arms were numb. Her face was numb. Her leg went numb. No more. That's almost 100% gone right now. And she still has this cortex remedy to take. I also found that she had Lyme infection affecting a part of the brain called the thalamus. I'll show a image where the thalamus is in the brain. Your thalamus in your brain helps you regulate sensory and motor to the entire body. Sensory and motor. Going back several years ago in the beginning of my postgraduate studies in functional neurology and human brain dissection, I had a patient come into my clinic before I do what I do now, before I knew what I know now. He had a stroke in the thalamus of his brain. Lovely man, very nice guy, but this stroke in the thalamus of his brain, this little tiny tissue of the brain, caused numbness and burning to go down the whole side of his body, from head to toe on one side, front to back, the whole side of the body was a constant burn and numbing. Constant. Even with all the medications the doctors gave him and blood pressure medications, that pain did not go away. That's something that set me on a journey to be able to figure out why something would like that happen. What else could be in the thalamus that could make somebody else hurt who hasn't even had a stroke? She had Lyme infection in her thalamus. She's already taken that highly energized liquid drop to help her body get the Lyme out of that thalamus, and she is doing amazing. I found in her kidneys dental mercury from her teeth. I found an anesthetic from previous surgery that she's had called propofol. It's stuck in her kidneys. Midazolam, which is a sedative chemical, stuck in her kidneys. Aluminum in the kidneys. Mycoplasma bacteria in her kidneys as well. I also found that the dental mercury had traveled to her thyroid and into her brain. Now that mercury we haven't even touched yet in her brain and her thyroid because it's still in her mouth. She's got those mercury fillings, so-called silver fillings, in her teeth. She's got a root canal that we've got to handle. I don't like root canals, and that's in one of her teeth in the upper left side of her jaw. I prefer to get that root canal extracted, and I get that tooth from the dentist, and I'm able to use that tooth and find where the tooth infections and the dead energy of the root canal tooth migrated to parts of the brain and the body. And with my method, we can get that tooth, those infections from that tooth and the dead energy out of, let's say, her thyroid, out of, let's say, her brain, out of the kidney, out of the aorta, out of the heart, wherever those infections and the dead energy had migrated to. Once I have that tooth extracted, I can use that tooth to find where it went in the body and get it out of her without getting into too much detail about that. She's following the right kind of diet now, because in my method with the food exam that I performed with her, and you could read about it again more on my website, the food exam, I find what the body is reacting against that she needs to avoid and which foods are approved, so that she stops stressing herself with the food. So it's not just going organic, it's not just going gluten-free or dairy-free. We've got to understand that there are different foods, even a spice, a condiment, a sugar, an egg, even celery or tomato. These different foods can cause problems in people's bodies, and we've got to find out, could citrus fruits be okay? Are the other kind of fruits okay or not? Are vegetables okay or not? If vegetables are okay, maybe only one vegetable is not okay. Maybe only one out of the, or two or three or 10, or several out of the nightshade groups are not okay or are okay. We've got to find out what you have to avoid, number one. But number two, you don't have to avoid those foods forever, not for the rest of your life. What I'm able to do, and what I understand, and this I was mentored by a biochemist. He was a PhD in biochemistry, and he helped me understand that it wasn't the food that caused the problem. It was the infections in the organs that were causing the person to be sensitive to the food. When we can find those infections in the organs that are causing the person to be sensitive to the food, and we remove those infections from the body, then the person's not sensitive to the food anymore. And that's exactly my point of view. Because when I help somebody get rid of the causes of the sensitivities to the food, that doesn't mean eat food that's not organic, because you don't want the poisons in the food that they put into the food, because that also is something I find in the brain and the body of a human that we have to get out of there. But we want to eat organic, but there are still even organic foods that can bother a person. When we get rid of the causes of the food sensitivity, people don't have to be, they won't be sensitive to the food anymore. They can enjoy those foods again. I'll actually show you a clip. There's a video here with a young lady. She was 19. She had a serious corn problem. No more. She couldn't breathe. She had opening, bleeding blisters in her mouth and her throat when she would eat or even smell corn or any corn byproduct that was on a certain food, like table salt. She's free from that. You can watch that video as well and understand it's possible to overcome these food sensitivities with my work. It's possible to overcome these pain disorders and fatigue disorders with my work. Okay, I'm looking forward to helping you. I'll tell you right now, insurance companies unfortunately don't recognize my work, and that's how it is. So this will be an investment in yourself, and she just said she's she is amazed at how fast she's feeling better, and suffered for 5 years with different doctors who got her nowhere with medications and antibiotics and other kinds of supplements that she took and other diets that she tried. No result, but getting worse on those methods or those plans of care. And now she's got or getting her life back, and almost 100% back in a very rapid time. Go to my website. I look forward to helping you. Find me on Facebook, find me on Instagram, subscribe here on my YouTube channel. You deserve to get better. You deserve to have somebody with integrity help you get better. Don't listen to the naysayers out there. You can get better even if you've tried 20 other doctors who haven't been able to help you, even if you've been sick for 30 years of your life. You can get better, and it can happen rapidly for you. And I'd love to be the person who helps you get better, because I love more than anything, what drives me is seeing a person like this who suffered so horribly for so many years get better with my care. Now stay tuned. If you'd like to watch her whole testimonial video, I'll put this here now at the end of this video of my discussion. You can get better. She is better. She is loving life again, and you can too. Watch the remainder of this video, and don't hesitate. The time is now for you to take action. Take action now and get your life back. Glad you're with me, Mrs. Moore. I'm glad that we could get together today, and I really appreciate your help with me helping people who are suffering terribly from these chronic, painful ailments, as well as chronic fatigue and other things that you've suffered with. And you're doing so remarkable that you told me yesterday on the phone, you're doing so remarkable already within the first month of your first protocol with me, that I just thought it was great that you're willing to share with people how, what's going on already. So I'd like to ask you, the list of symptoms that you've dealt with, number one was chronic fatigue, right?
Yes.
Number two, you've had terrible body pain.
Yes.
You've had numbness, you've had tingling. Yeah, you've had headaches, you've had pain in the head, you've had a number of different things. So how long had you dealt with these symptoms before you came to my clinic, which you just came to my clinic September 24th of 2020?
Yes, I've dealt with them for almost 5 years.
Almost 5 years. And did they all just come on you at once, or was it a gradual increase into all these symptoms taking over your body?
At first, they kind of all came in at once, and then they stopped a little bit, but then they started coming in a little stronger than when they began. So it was it was strong.
And by the time that you came to my clinic in September of 2020, were all of these symptoms constant, or did you have break? They were constant. Okay.
They were daily.
And so number one, I just want to go through to let people know the severity of the symptoms before you came to me and where we've gotten to now within the first month of the protocol. So your energy level, your chronic fatigue, on a scale of 0 to 10, if 10 is the worst fatigue, the worst exhaustion, could you describe what yours was like?
Mine was 10 and above. I mean, it was everything that I can do in the mornings to get up and go to work and come home, and I was just exhausted. All I want, just came home and went to bed. It was horrible. I had no energy on the weekends. All I did was sleep because I had no energy. I was so tired. If I went to the store, I had to take a break at the store, sit somewhere because I felt like I was going to pass out. I was dizzy. I just get the dizzy spells out of nowhere. And then on the way home, my husband would drive and I'd take a nap, and it's only 20 minutes away. And I get home and I go straight to bed. So that was basically what I did on a daily. And now I don't even take a nap.
Awesome. I love the smile. That's great. And you don't even take a nap, and you can, you told me yesterday that you went hiking in the mountains.
I did. We went to Yosemite. And it was beautiful. And we took it was a 5-mile hike, and it was uphill. Let me tell you, that was steep. And I did amazing. I had no shortness of breath. I had no fatigue. I mean, it was really good. Everybody was telling me, slow down. I thought you were the sick one. They were huffing and puffing, and I'm just like, oh my God, I love this.
Excellent,
So,
beautiful. And you also had told me one of the concerns was just like you getting up. On another note about the chronic fatigue, you getting up in the morning. What was
hmm
it like for you, and what kind of assistance did you need?
my husband would come around my side of the bed and he would literally help me up, like literally pick me up, just reach down and pick me up and help me get out of the bed and stand up
Mm,
and get my day going
mm.
because I was just my muscles ached so bad. Um, my head hurt. I would wake up with a headache every day. And so I just needed that little help me I can get going. And he's been awesome. I couldn't have done it without him. He's just been there for me every step of the way. So,
And your headaches, how severe were those on a scale of 0 to 10, if 10 is the worst?
oh goodness, they were 10.
There were 10.
It
Was
was,
that daily
yeah.
for you?
I'm sorry.
Were those daily?
Yes.
And
They're basically on the base of my skull, like behind my ears.
mm,
I felt like my bones back there were just crushing. I mean, that pain, it was just unreal. And then my neck just, I don't know if it was due to the head, that pain, my neck also hurt really bad.
and that was daily for you,
Yes,
both of those. And when was the last time that do you have the neck pain now?
I do. I get the pressure on the back of my head and the neck pain, but it's not, I'm gonna say I'm probably at compared to where I was, like where it was just horrible, I'm probably like around a 4 or 5.
So
So
you're
it's
about 50 to 60% reduction
hmm
in that pain in the head and in the neck.
exact.
That's phenomenal.
Yeah.
And how many years did you suffer with that head pain and neck pain?
Oh my gosh. Since I started with this situation about, almost 5 years.
How many doctors did you go to for these conditions? So far, what we're talking about, the fatigue and the shortness of breath, which we're going to get into some detail about that. But the fatigue and the headaches and the neck pain, how many doctors have you been to for these two?
I've been to, aside from you, I've been to 3.
Mm-hmm. And
Yeah.
were they medical or alternative?
One was alternative, but I really didn't get to see her very, quite a lot because they just kind of do a brief and then they bring you back. But she didn't give me, her appointments are way out there, so I didn't go. I didn't, it's not even here, so I'm not going to go. But the other ones, they were just regular medical doctors,
Mm-hmm.
and
And
obviously,
what do the medical doctors do? Did they take images like X-rays, CT
hmm
scans, MRIs? Did they take blood tests?
yes,
Just
the
medication?
whole thing, the MRIs, the medication, and take this for the headaches, take this for the joint aches. My primary doctor, she would tell me to take some herbs for certain things, but it just felt like on a day to day, I was just getting worse every day. I just felt just couldn't. So finally, that's when I talked to her, and she knew I was desperate because I couldn't. That's when I started having my stomach problems where I couldn't eat.
Mm-hmm.
And I mean, I could not eat, I could not drink water. It was just daily where, I mean, I'm not a big person to begin with, and I was just losing weight. I mean, in a month, I lost around 20 pounds.
Wow.
And that's when I ended up going to you. And here they're just not giving me anything. They're giving me medication for acid reflux and all that stuff. But I mean, it on there it just says it hurts your kidneys, and I'm already trying to heal my body, and I'm not gonna try to hurt my kidney while I'm at it.
Mm-hmm.
But I didn't take it. But now since I started the protocol, I'm actually really good. I can eat, I can drink all the water I want, and I mean I have the energy, so I'm doing really good. I'm so
Excellent.
grateful. Yeah.
Excellent. And when you said before you couldn't go to that other doctor, you just said a few minutes ago you couldn't go because it was like not close to you. You referenced something like that. But you traveled across the United States to come to me.
No, she was actually 3 hours away from me, but they don't the way she was going to do everything is she was going to wait till next year, August of next year.
Mm-hmm.
And then I looked into it and everything was basically on antibiotics.
Hmm.
They start you out on antibiotics, and I was on antibiotics when I went to you. If you recall, I was on 3 different kind of antibiotics, and I just couldn't do that because it was just killing my stomach.
Yeah.
Every day I was nauseous.
Have you continued to take those since you've been on the protocol with me?
No, I
You cut
stopped
them out.
them the day I went to see you.
And you're doing so much better already. And the stomach
Oh
pain,
yeah.
if we can talk about that stomach pain, because now you weren't able to eat, you weren't able to drink water. Was that pain a stabbing, a burning, a knot-like feeling? Like what, how can you describe what that stomach was like?
It was a burning feeling. It just felt like my stomach was on fire, and it was like my stomach was bloated. Just I felt like it was swollen, and it was just painful. Here and there, I would get the stabbing, kind of like the cramps,
Hmm.
um, but it was horrible. And then that was, I think, what was creating a lot of my where I felt like my heart was just racing. And maybe I was panicking because my stomach was doing something because they told me it was, some doctors said that it could be a little bit of a panic attack that I get when I feel like I can't swallow. It's just a reaction of my brain to my body saying you can't swallow. So there's a little bit of a, sorry about that.
Hmm.
There's a little bit of a panic, I guess that happens even if I don't realize it. So
Hmm.
that's where my doctors over here are thinking that that's where that heart palpitations are coming from. But
Hmm.
I mean, I
And
feel good. So,
yeah, the heart palpitation. So the stomach pain is gone.
hmm,
Stomach pain is totally gone. And
yeah,
no acid reflux meds. There's no other medications besides these remedies that you're taking from me.
yeah,
Yeah, that's
that's
it.
all I'm taking.
And the heart racing feeling, the anxiety feeling, that's decreased.
It
Yeah.
has
Because you're feeling
decreased. Yeah, I am feeling a lot better, and it's like I'm just, I'm just doing really good. I'm so
better.
excited.
Yeah. I wanted a couple of other symptoms. You said that you had a lot of nausea when you had the headaches. You had the nausea. So since the headaches have decreased, did the nausea decrease?
Oh yeah,
Is the
yeah.
nausea totally gone?
It is. It is gone, and the lightheadedness. I would get like super lightheaded if I bent down to pick up something and I stood up. I was holding on to something because I was really dizzy.
Hmm.
That's basically gone. I get it here and there, but it's basically gone.
Hmm.
So that's been really good.
And
The nausea is gone.
nausea's gone. The balance problem. You had a dizziness in addition to what you just said, but you also had walking. You felt like you were going
Oh,
to fall into a wall or walk into a wall,
yeah.
right?
Yes, like my husband would say, is stay in my lane because I was running into him wherever we were. But no, that's decreased tremendously.
Awesome.
Yeah, I don't feel like I'm off balance. Before I could feel myself. I
Hmm.
felt myself walking, but I felt myself not walking in a straight line. And I don't even drink. But I felt like I was like a little drunk there, and I would just run into the wall.
Wow.
And my husband would say, what did you run into?" And I said, "I didn't mean to. I just kind of like I would just go into it."
Hmm.
And now I haven't had that.
Remarkable.
Um, Here and there, I feel it a little, but it's not like I was. I mean, it was daily. I would get up in the morning, and the first thing I would do when I would walk is I feel myself going sideways.
Mm.
So yeah,
And now
it's
and you're like halfway maybe through this first protocol with me,
yeah.
right?
I'm
So
at
that's it. So you
32
still have
days,
much.
I think.
Day 32, yeah, because you have 60 days. So you still have more to do. So that's going to go away. That'll be
Oh yeah.
100% gone. Um, you had your hands and your feet. What was the symptom with the hands and the feet? Cold,
Uh,
hot, rash, red?
yes, my hands had like they were peeling. The
Hmm.
my hands was peeling. They would just peel like I had like a fungus on my hands. They would just peel. I get these little blisters, and then they would just all of a sudden my hands would get really hot, and you can see the redness on the palm of my hands, and they would burn. And I would touch my husband, and he would be like, "Your hands are on fire." And I'm like, "Yep, that's how they feel." My feet would do the same thing. They would also get those little blisters and peel, and then they would get really hot or really cold, and my hands would do the same. And I'm going to say about almost 3 weeks now, I have not had that on my hands or my feet. So it's
Awesome.
like, oh,
That's
yeah,
amazing.
they're not on fire.
That'll decrease the anxiety feeling and the heart racing
Oh,
also.
yes. Yeah,
Awesome.
because when I would get that on my hands, I would also feel this heat just rushing through my body, and then it would go like up towards my head, and I felt like I was gonna pass out.
Mm.
It would just feel like I was gonna, I did that a few times where, I mean, one day I was at a little service for a funeral, and I almost passed out there. So that was kind of, you know, in the wrong place to have that happen, but it did.
Mm.
And I mean, ever since I started my program, that went away, which is amazing because it
Wonderful.
was an awful feeling. Yeah.
Beautiful. Your doctors, if they ever see you again, which you don't need to see them again, but if they ever did, they're probably looking at you saying, "What is going on? How are you doing this?"
Oh, yeah.
Let's talk
My,
about that in just a minute. I want to hold on
yeah.
because you had another symptom. Let's go with this other one. You had the tingling and the numbness, right, in the left arm. You had the legs tingling. You had a constant problem on the left leg. You had the hoarse voice. You had
Mm-hmm.
the facial numbness on the left side of your face, your hands, and so on. So, can you describe all of this?
Mm-hmm. Yeah.
And
My left side obviously is the one that's been affected throughout this process that I've been. And I felt my face numb.
I'm sorry, throughout the process, throughout the whole time of feeling ill and sick and hurt.
Yes.
Okay.
Throughout my 4 almost 5 years,
Mhm.
that's where it started. It started on my left side, to the point where when I first had the symptom, I thought I was having a stroke, and it scared me. And I went to the hospital, and they're like, "No, you're fine." And I'm like, "Then what is it?" So, but I do have, where my left side, my face, my arm, my leg, even my stomach on the left side, it feels numb, like where I can touch my face like that and I feel it where it's numb and it would tingle. I feel that tingling, and I actually, from my skull to my feet, I would feel like something was crawling in there. Like I could literally almost see these little circles appear on my arm, my legs, sometimes my face. It almost looked like a little ring that would appear on there, and I felt like something was walking in there. And I would tell my husband, "Look at this," and he would look, and it almost looked like goosebumps, but turned into like a little rings.
Mhm.
Um, I haven't. That has diminished like a lot. I feel it once in a while where I feel the tingling and the numbness. I have not felt the walking feeling where, I felt the little circles that would be created on my skin. I have not felt those. Um, the numbness is basically, I'm going to say, if I was to put it on a scale, I'm going to say maybe about a 4, where I could feel it, but it's not to the point where I felt where my leg was even heavy. My arm, I would sometimes test my arm to see if I could lift it because it felt numb to where I lifted, and it was just heavy. That's diminished a lot.
How much
So
so? You think that the numbness and the tingling in the arm and the leg and the face, all three areas have diminished by, you're saying about 60%?
oh
Is that,
yeah.
yeah?
Oh yeah. Yeah.
Yeah?
Yeah.
Okay. And that's also within the first month of this protocol.
Hmm.
You also had to hold your left arm up in the air, you said, because the numbness and tingling, you would get it to decrease with that, raising it above your head.
Yeah.
But you don't have to
Yeah.
do that anymore now.
No,
Hmm.
not anymore.
Hmm.
It's been doing really good. Um, I haven't had my the tingling is bad, like I said. So I'm really happy with that.
Awesome.
It doesn't
Uh,
bother me.
what's that?
I said it doesn't bother me.
You said that your neck had a rattling and like a jiggly feeling in the back of the neck, like your neck, back of your head and neck were not connected, and
Yes.
your scalp was crawling. You had a crawling sensation in there as well.
Hmm. Yes. The base of my skull back here, where it connects to my neck, if I go like this, I wiggle it like that, it 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 still has it, but it's not as bad. It feels like if you had like your bones in there were just loose and they just rattle. But I notice when it does that, like right now, I don't feel it. that it's there, but it's not as bad. When I feel it, when it does it, and I feel it like quite a bit, is when I feel most of my, like the pressure on the back of my skull.
Mhm.
Um, and then I'll feel a little bit of the tingling on my left side. In my eye, especially my left eye, I feel like there's a lot of pressure
Mhm.
behind my eye. And I know that we had mentioned that there was something in my eye socket or some, when you did the test.
Mhm.
I think there was some sort of bacteria in there that we were going to target when I removed my teeth, as
Mhm.
my husband calls it.
Well, we don't have to pull all the teeth out, but we have a
No,
couple.
no.
Mhm. I'll talk about the dental work in another video that I'm going to make and put together with this,
Yeah.
but still the reduction in the symptom is really remarkable in there,
Oh, yeah.
in the neck and the head.
Oh, yeah.
You also, there's one more thing here. I think you said it feels like your liver hurts from the back to the front. Is that still going on and was worse at night? Is that still happening at this point?
It happens maybe once. I think I had it happen once since I started the protocol.
Mhm.
Um, and and that was the only time, because before I felt swollen on, just my stomach, it just tight. Now it's been good. I've had it only once.
Only once. That used to be every day, every night.
Mm-hmm.
Yeah.
Every
So
day.
gone, almost gone.
Yeah.
You, so your energy level is dramatically increased.
Oh,
The
yeah.
pain, you also had muscle pain and joint pain. How's
Yes.
that now? How severe was it and what is it like now?
Oh, it was horrible. I mean, I would walk and I'd be ouch, ouch, ouch. Now it's a lot less. I'm gonna say, like, about 50, 60% less.
Mhm.
It just mainly, I feel it more on my bigger joints, like my hip joints and maybe my knees,
Mhm.
but my my elbows feel good, my shoulders feel good now.
And they used to hurt
Um,
horribly.
yeah, oh yeah.
Yeah.
And it's really weird because the bottom of my feet hurt so bad that I know we've all been to a Costco or a Sam's, and when you walk in there, they have those little things on the entrance that are like little circles that you roll your cart through it and it goes tut, tut, tut.
Mhm.
And those little circles, I would step on them with my shoes and I couldn't stand it.
Mhm.
I would tell my husband, this hurts me so bad. Now it doesn't hurt. I
Awesome.
walk right through them like nothing.
Awesome. And I'll tell you something, congratulations. I'll tell you something that the next steps you have starting from day 32 on, you're getting into the kidney steps, which I'll talk about in another video to share with the public
Yeah.
what's going on with you, what I found and what we're treating. But those other hip pains and so on, they're going to decrease
Oh
totally
my
because
gosh,
you've got so
that'll
much,
be awesome.
yeah, there's too many chemicals and infections that have gotten into your kidneys that are relating to the hip pain.
Mm.
Is there any other, I really totally appreciate you a lot for helping me help people understand that this is possible, that they can overcome these symptoms that they've suffered for so long. Um, is there anything else that you want to tell anybody? And before we even get there, I just want to ask you this. Would you be willing to, in the future, when I get to see you again and you do recover even more than you have already, to share in another video to just update people and let them know like your journey?
Oh yes, of
Yeah.
course.
Okay.
I tell everybody, that I know that is going through some sort of ailment. I tell them to, I give them your number and I said, look him up. I said, because he's amazing and I'm feeling amazing. And so, I mean, everybody deserves to find their health somewhere. And the
What did
main doctors are not going to do it.
what did your doctor tell you when she saw you the other day?
Oh, she was amazed. She's an amazing woman and I love her. And she's very, very she likes the medicine that you do. She's seen it before. And she told me, she's like, whatever you're doing is working for you amazing. She was getting ready to send me to what did she call it? A doctor to check my genetics, because she said that she didn't know what was wrong with me and she felt there was something within my genes, I guess, that maybe there was a faulty gene that nothing was working for me. But she said, you are doing amazing, you look amazing. And she even asked me for your number because she's going to send some people to you, because she said they're really sick and they haven't been able to find a cure anywhere. So
Mhm.
I said, yeah, here you go. I'll give it to you.
Thank you.
So she was really happy that I'm looking a lot better, compared to the last time she saw me. Yeah.
Is there anything else that you'd like to tell the world, tell the public? You know, what you've, I mean, we've talked a lot and shared a lot. Is there anything else that you'd like to tell them? And then I'll let you go to work. I
You
appreciate
know,
you.
for me, what I want to tell people is I know that sometimes, we look at ourselves and we're not feeling good. We're literally at our end, and we think I can't do this because I can't afford it. I feel that you should look into whatever you can to make it to your clinic, because it'll be worth it. Every penny you spent, it will be worth it. I promise.
Thank you.
I'm proof of it. Look at me. I'm smiling.
Yeah. They didn't get to see you when you were in pain. So, but yeah,
Oh yeah.
it's
And,
terrific.
and like you said, I'm always smiling, because to me, positive attitude in the morning gives you a positive, outlook on the day. And even if you're feeling the way I used to feel, I would always have a positive look on life, because nobody needed to deal with what I was going through. So, I just basically, you put on a front
Mhm.
to go on with your day, even though you don't feel like it. But I've always been that type of person where, I mean, what I'm going through is my own journey, and I'm going to smile through the day, and hopefully nobody notices. But a lot of people did, no matter what, because I'm always this lively and happy, and they noticed I wasn't as happy
Mhm.
as I am now. And they notice now. They tell me, what's going on? You're so happy.
Beautiful, beautiful. I love it.
Yeah.
I'm so happy to hear about that, and thank you for sharing with everybody out there.
Well, thank you.
And I can't say it enough. I really appreciate you for giving me the opportunity to help you and your family and your friends to see you, come back to life. And it's wonderful. And
Yeah.
I look forward to more recovery for you, because it's
Oh,
definitely
me too.
happened. It's happening, and it's all coming your way. You can have better health now, and better function now, and better energy now, and for your future than you even had probably 10 years ago, even before you started to feel bad.
Oh,
It's
yeah.
awesome.
Yeah.
Awesome.
No, it's amazing. Thank you.